My name is Kim Kaufman. I was born in 1969 with a cleft palate and cleft lip. I've had surgeries from about 3 months of age through 19 years of age. Everything was fine and resolved until about age 38 when I experienced a complete failure of the dental solution that had been given to me. I had sinus infections, I had gum infections, I had tissue infections, and I think that in large part it was because my mouth really needed to be treated differently than it was. And you can't simply do tissue graft or bone graft when you already have so much infection because the first thing hadn't been resolved. And so unfortunately it took me probably a good 8 months to realize that I didn't have the right team of people in place.
Kim was kind of our typical adult cleft lip and palate patient, somebody who'd been through many surgeries over the years, starting in early childhood as a baby in repairing the lip and the gum tissue. And there's a number of dental problems associated with a cleft. I think she had had a dental implant that was removed. She kind of had a recurring infection that would not go away despite other surgeons trying to take care of it. And the plastic surgeon said, "Larry, would you see Kim and kind of figure out what she needs to have done, and let's put together a treatment plan."
I had no idea that the solution that was in place from, really when I was 19 years old would ever fail. It was complete shock to me when it did. And, to have 2 young kids and be going through all of these procedures was a bit grueling. But luckily, once I found the right team, it was a breeze after that. I had just the most amazing care, and it really makes all the difference in the world when you trust the prosthodontist and you trust the process that you're going through, and have the confidence that at the end of all the procedures, you're actually going to have sort of a solution for your lifetime.
We did a diagnostic workup and realized that we really needed a team approach here. We needed a prosthodontist, we needed an implant surgeon, we needed our plastic surgeon, and again, the role of the prosthodontist for Kim was kind of coordinating everything and trying to understand what everybody could do, what their capabilities would be, and kind of how to orchestrate it when each of the players would have their piece in her rehabilitation.
The teeth that I used to have were fine. I actually never realized how inferior they were until Dr. Brecht and his team built me the teeth that I have today. I call them museum quality teeth. I'm a jewelry designer, and in the jewelry world, when a piece is built beautifully and to a certain level by a master goldsmith, it's called museum quality jewelry. And I really feel that Dr. Brecht and his team deliver museum quality teeth.